opioid crisis and how it relates to pain for people that are suffering day in, day out, whether it's through an illness or a disease or an injury or something like that. There has to be a balance. And I just don't know how we get there. So let me welcome to the show. And I'm so excited to finally be able to do this topic. Claudia A. Merandi. She is with the Doctor Patient Forum and Don't Punish Pain, the world's largest pain advocacy group. You can find it at thedoctorpatientforum.com. Claudia, thank you so much for joining us on the Nikki Maduro Show.
Thank you for having me, Nikki.
Okay, so I guess first off, introduce yourself to people that maybe haven't heard of you and kind of how you got into this whole pain management, pain advocacy.
Sure. So I started to get sick with Crohn's disease when I was about 4 years old. My dad had Crohn's disease. And after when I first became a court reporter, I'm a retired court stenographer, I started to get really sick with Crohn's. So much so that I was being admitted to the hospital on a regular basis. Part of Crohn's disease comes a lot of pain. And as my disease progressed, it got worse and worse. I would eventually spend about 10 years in a hospital. I would have to have a colostomy bag, a reversal, and I raised my kids from my hospital bed. And it was probably around 2015. I went to the emergency room, or 2014, I forget. And a doctor accused me of drug seeking. And I was confused because I had never been accused of drug seeking. And let's face it, when you go to the emergency room, it's usually for pain.
Right.
And that doctor accused me of drug seeking. I was discharged. I have a port in my chest. It was still accessed. I was mortified. And I had to get readmitted. And I left with a colostomy bag. And this doctor just thought, well, she's a drug seeker, discharged me, got admitted. And my mom at that time said, oh my God, if this is happening to you, God only knows how poor people are, you know what I mean? Like, not everybody has the benefit to have the knowledge that I did from being a court reporter. And poor people are treated like dogs, let's face it, especially in the healthcare system. I went on social media. I announced I was going to organize a national protest for people who could no longer get pain medication because the CDC posted these opioid prescribing guidelines. I started with 3 members. Today, there's over 30,000. There's chapters in all 50 states, 1 in Canada, 1 in the UK, 1 in Australia. And I organize rallies. I'm a lobbyist. I get laws passed protecting pain patients. I raise awareness to innocent doctors who are incarcerated for treating pain. And I also host an in-person support group. So we wear a huge hat. People contact us before their first suicide attempt because they can't get their pain treated. So I'm called in to advocate for people who are rushed into the hospital. Their pain is, ignored. And some of these people, if they have a history of addiction, they're never going to get their pain treated. And this was the government's response to combating an opioid epidemic, that people think we had this huge opioid epidemic, but the CDC silently acknowledged that they conflated heroin overdoses in with prescription pain pill overdoses. We vilified the Sackler family. We have all of these Hollywood, painkiller and Dopsick.
Yes.
See, everybody wanted to capitalize off of an epidemic that we really didn't have, because at the height of the overdosing epidemic, the CDC said there were 67,000 deaths from pills, but then they said, well, it was more like 17,000. And then the more people would probe, it was actually reduced to close to 7,000. 7,000 is not an epidemic, but the government created their epidemic. And now we have over 100,000 dead Americans from fentanyl. And the people that blame pain pills for their addiction, 80% of those people were already abusing other drugs. And those pain pills were actually a safe supply of drugs. Now, I'm not saying that nobody becomes hooked on pain pills. We know that happens, but we didn't have the epidemic that the government said that we did, because prescribing has been reduced by close to 70% now. Overdoses have never been higher.
So kind of talk about Why overdosing? Now, do you see a connection between the reduction in opioids being prescribed and the fentanyl epidemic? Because I
Oh,
kind of feel like people are self medicating because their doctors aren't giving them
oh yeah.
the
Yeah, I mean,
legal opioids.
oh yeah, absolutely. And the pain community, they're not street savvy people, right? And now you've got a new community that's hitting the street. They don't know anything about street drugs. I mean, my elderly people, they don't know what illicit fentanyl is. And in the fentanyl that people are dying from, that's not pharmaceutical grade fentanyl. That's fentanyl that's being shipped over our borders.
Mhm.
And the DEA, they failed miserably tackling the cartel. So it was easier to target doctors, elderly solo practitioners. And they needed to make examples out of people. So they made examples out of these elderly doctors. But people they're desperate for pain relief.
Yeah.
And the cartel is happy to accommodate
Absolutely.
the country. But if overdoses are bad now, give it another year. It's going to be staggering in another year. It's really, really
So
sad for the
sad.
country. Yeah.
How do you, and this is I maybe too complicated a question. How do you manage pain without becoming addicted? Is that something that is a struggle for a lot of people?
Yeah, that's a great question.
Mm.
So I have been prescribed pain medication on and off since I was probably in my 20s. Now, my dad was a city bus driver and he also had Crohn's disease. When I was first given pain pills, it was probably during a hospital admission. And my dad, this is like 35 years ago. He's like, "Oh, Claude, you got to be careful. Some people get hooked
Yeah.
on pain pills, so you just have to be careful." Now, how did my dad, a city bus driver, know to tell me 35 years ago that pain pills are addictive, could be
Mm.
addictive, but nobody else in this country knew? I'm not buying it. Now,
Mm.
this is what I tell people. If you take a pain pill and you feel like, wow, this is great, you maybe shouldn't take pain pills again. But here's the deal: your doctor's prescribing you a medication in a controlled setting. Your doctor is trusting you. You have to trust your doctor. 8 out of 10 people that I advocate for that struggle with addiction didn't become addicted because of pain pills. They became addicted because of their environment. They became addicted because they didn't have an upbringing like I did. And I'm not a privileged person, but I had the benefit of having a mom and a dad and a structured life. These people are homeless. What have they got to lose? When you're homeless and
Yeah.
you're poor and you're treated like a rabid animal, the only time that you're going to feel good is when you're using, right?
Yeah.
Drugs don't cause addiction. Many, many things cause addiction, but what we're doing now, though, is now we're forcing people to the streets. But that's a really good question that you asked me, Kim, because now I have elderly people on hospice and their families call me and say, "Oh my God, Claudia, my mom doesn't want to take her pain pills because she thinks she's going to get addicted." And that's because of the opioid propaganda. And it's a lot for people to acknowledge. Well, I maybe there now I have lawmakers that contact me for guidance and they're like, "Well, wait a minute. We were told that OxyContin was to blame, but now we have the data and throughout the opioid epidemic, only 4% of the pills that were prescribed were OxyContin." So, scientifically, right? The numbers don't lie. It's not from it wasn't from OxyContin. The people that blame Oxy for their addiction, they were buying those drugs, they were stealing them. Did some people get hooked after a doctor prescribed them? Absolutely. Can't deny that, right? But I don't know a whole lot of pain patients. Think of it this way, Kim and Nikki. Think about everybody that you know in your life that's had surgery. So
Mm.
your mom, your dad, your grandparents, your cousins, your friends. How many of them have graduated to street drugs after being prescribed an opioid?
Yeah, no.
I
None in my
Yeah.
family, at
Mine
least.
either. Yeah.
None in mine. And my dad had cancer. My mom has cancer. My brother died sadly from kidney failure.
Oh, I'm
My
sorry.
siblings, right? And none of us graduated to street drugs because drugs don't cause addiction.
So I guess explain to me, as someone who watched Dopesick, right, Painkiller. I watched all of these Hollywood kind of films and TV series. And I'll be honest, I was hooked on him. I was
Sure.
totally watching him. And so when I would talk about it on this show, people like Rev P and others would be like, you have to talk to Claudia. You have to talk to someone within the chronic pain community because it's not telling the whole story. So what do they get wrong? I mean, was the Sackler family not giving incentives to salespeople to bump up the dosage? Was that not happening? Because I guess my mind doesn't connect the two of like, how is this information not getting out to people in the same way that this story about the Sackler family, Purdue Pharma, and opioids has?
Sure. So Dopsick, so Beth Macy wrote Dopesick, and then Danny Strong created it. And Danny Strong hired Dr. Andrew Kolodny, and I refer to him as the thought leader behind the untreated pain epidemic. In order for the CDC, in order to have all of that multi-district litigation, suing all of those drug companies, right, suing Purdue, they wouldn't have been able to do it without the CDC pushing through the guidelines. Once those guidelines were in place, we could have that successful multi-district litigation. Now, is the Purdue family, are the Sacklers these evil human beings that Hollywood portrays them? The Sackler family has done nothing different than any other drug company, including the makers of Suboxone today. Suboxone is a highly addictive opioid that's used to treat opioid addiction. And they're doing the exact same thing that the Sackler family did 30 years ago, but nobody's paying attention to it. Why? And if you notice, you never hear about OxyContin on the news anymore, right? Mm-hmm. Nobody hears about that. That's because there's no more lawsuits. They've paid out all the money. They've moved on. And the same people that testified in the litigation against all of these drug companies, those same people are going to be experts next in the multi-district litigation suing all of these social media companies. The Sackler family didn't do anything different that other drug companies are doing, but there needed to be a scapegoat. The scapegoat had to be the Sackler family. In my opinion, the Sackler family is guilty of making a great product. That OxyContin saved my life because with Crohn's disease, I would sometimes run to the bathroom like 30 times overnight. And I think I was on like 10 milligrams, the lowest dose of OxyContin. I took one before I went to bed, and I could sleep through the whole night. And when I learned that people were abusing OxyContin, I was like, God, how? Because I just always felt nauseous when I took that medication. So I think it was convenient to vilify the Sackler family. But in my opinion, there's drug makers today that are making opioids that make the Sackler family look like a rescue effort. It really is bananas. But people love Hollywood, right? Yeah. You watch Dopesick, and some people, they have to believe it because they watched it. Same with Painkiller, but it's all the same. And if you talked with these directors of these movies, they espouse this opioid propaganda, and they've never done any fact checking. Nobody really ever bothered to see, well, how much OxyContin was prescribed. We only know this because that's our job at the doctor-patient forum.
Right. So how should we view pain management? I mean, do you guys follow any sort of research on, maybe there's a surgical solution? My daughter has Crohn's. And so when you mention Crohn's, obviously, like my mind immediately goes to what could be the future for my child and having to manage her pain with that disease. But is there a way of managing pain without opioids? I mean, is that ever the goal for, your organization of finding ways to get, I guess, big pharma out of the pain business?
So we have all of these drill mills that have taken the place of the supposed pill mills. And the drill mills are the interventional pain doctors that force people into getting these painful, unnecessary procedures. For instance, an epidural steroid injection, right? I think 9 million epidural steroid injections were given in 1 year. The reimbursement rate for an epidural steroid injection is about $2,000. But what most people don't know is that those procedures are not approved by the FDA and they've been banned in other countries.
Oh.
So for people that have these low back issues, they've been bamboozled into all of these gimmicks, like the spinal cord stimulator. And the interventional pain industry was a driving force behind the opioid elimination industry. See, there had to be a meeting somewhere about 25 years ago. And interventional pain was there, and you have all of these experts that testified, all of these special interest groups, former head of the CDC, Tom Frieden. And they were like, look, this is a win-win situation. We're going to push through these guidelines. A bunch of people are going to blow their heads off, but we don't care because they're poor pain patients. You're going to make money. I'm going to make money. Nobody cares about the patient. We'll just wait for all the patients to die.
Ugh.
Are there alternatives to FDA-approved opioids? In my opinion, nothing is as tried and true as a full agonist opioid. And in theory, in a perfect world, I would love to, come on your podcast and say, oh, there's so many alternatives, but there's these greedy doctors. These are greedy, egregious pigs who take advantage of desperate people. I had a doctor on LinkedIn that tried to sell me a spinal cord stimulator for my Crohn's disease. And I was like, you go find your moral compass. You're a liar. Now, why would somebody like me with Crohn's disease fall for a gimmick like a spinal cord stimulator? So they're willing to put you to sleep, put a product in you that's not being used in other countries, and then have that product explode in you, shock you, all to avoid prescribing an opioid. I mean, this is madness. Or these, a mom called me and their little one had their tonsils removed. He was 9 years old. They didn't want to give him any pain medication
Because they're so afraid.
He had to be admitted for pain relief. That little boy has PTSD right now. Now, this is where it gets dangerous. Let's say there's a 16-year-old and we ignore that teenager's pain. That kid could go on Snapchat, buy what they think is a Percocet, and mom and dad's going to find them dead in their bed from fentanyl. And that happens all the time.
You have a question from Calvin Wong, who wants to know your opinion, Claudia, on the THC products and on marijuana.
I think cannabis could be great as an add-on therapy, but it's failed miserably in clinical trials. It's not the panacea for pain relief. Once again, ton of doctors promoting cannabis as if it's the panacea for pain relief. They're liars. It isn't. I have no problem. I tell people, I've got a massive following on TikTok. I'm like, you want to smoke a big fatty? Smoke away. None of my business.
Right.
You smoke, it makes you feel good. There's nothing wrong with feeling good, but it's not a replacement. I've been called in to advocate not once, but 2 times for a cannabis dispensary owner whose wife has MS. And, even the cannabis, that whole industry is saturated. I think it could be as an add-on therapy, but also I'm seeing a lot of really bad things happening to teenagers. They're getting their hands on this high, this
Potency,
THC.
Yeah. We have someone that wanted to speak with you. Lori is one of our listeners. You'll have to unmute yourself, Lori, if you wanted to ask Claudia a question.
Hi.
Okay, go ahead.
Okay?
Yeah, go ahead.
Okay, so hi, I've been on prescription pain meds for over 55 years. And I essentially have been on the same, first it was codeine, then Darvon, they took that off the market, then Tramadol. And I've been on the same amount pretty much until recently. I have additional stuff that's come up, but for all that time. And I'm also a scientist, and I did some research on this, and I really want people to understand that your body metabolizes endorphin analogs differently when you are in pain than when you take them to feel a buzz. And if you're taking enough to just tamp down I'm never in zero pain, right? But I take the amount I take lets me have I'm not an athlete, so I couldn't go play tennis or be a professional dancer or something. But have a normal life. I exercise, I would usually have a job and that kind of thing. And doctors finally kind of found, I'm also a scientist, and I did the research because there was so much. I even lived with a guy that got addicted to heroin for different reasons. And so I said, why am I able to take the same amount for all these years and it still works enough for me? And so I did the research because I am a scientist and a researcher. And I found the research about how your body metabolizes. Doctors kind of caught up because they used to, after surgery, sorry, I'm kind of amped right now because I'm talking to you. After surgery, they had that like time limit, and they don't do that anymore because they know your body, when you have pain, metabolizes these opioids, which are endorphin analogs, differently than when you don't have pain. And if you take enough to get that buzz or that high, that's when people get addicted, right? But if you're just taking enough to deal with your pain and your deficiency in endorphins that your body's producing, that really doesn't happen. And more people need to understand this. But if you're trying to get that, ooh, that feels good,
Right.
then
If you're trying to get high
to it, right? Because you're going over what you need.
Right.
And you get high. I don't ever feel that way, except for the fact that when the pain gets, if I wait too long and the pain gets really extreme, and then when the stuff kicks in, I feel a relief of the pain lowering. It's not like I feel a buzz. I used to get high when I was a kid. I know what a buzz feels like. I don't get that from my pain meds.
And Lori, thank you for sharing that. So Claudia, if Lori, and thank you so much for being on the show, Lori.
Thanks, Lori.
If Lori knows that as a scientist and a researcher, why don't doctors? I mean, what is, why don't doctors be like, no, I understand what's happening to their body. They're not getting high. They need this for the pain.
They're afraid because doctors have gone to prison. And part of the opioid elimination industry, you've got these special interest groups. And there's one I'm organizing a protest outside Brandeis University next Wednesday. And Dr. Andrew Kolodny, there was a group of doctors, they're called PROP, and they are the thought leaders behind this epidemic. And they have grossly exaggerated. They're addicted to lying, right? They're like pain patients, they're lazy malingerers, and they play the illness so they can get a paycheck from the system, and they need higher doses and higher doses. And they are the original creators behind the false narrative against opioids. And then ironically, they would all become experts in multi-district litigation. And then they'd be hired on Dopsick and painkiller. And this is so hard. When I say this to people, they can't believe it. There was never a prescription pain pill epidemic. There was liberal prescribing. But think of it. When there was liberal prescribing, there were 6,000 people, 7,000 people dead. Now there's 100,000 dead people. The people that created the false narrative, they should be responsible for the 600% increase in deadly overdoses. And I feel so badly for the moms that contacted me and said, I went in my daughter's room and she was dead. She went to a party last night. My daughter wasn't a drug addict. And I don't say that to be disparaging to drug addicts, because nobody fights harder for an addict than I do. Not even their own community, right? And she said, my daughter thought she was taking an Adderall, because when we're teenagers, I experimented with drugs. She found her teenager dead. And I blame that organization PROP, because that didn't have to happen. And these doctors, they've stopped prescribing ADHD medication. They are all afraid. Part of the opioid elimination industry, once again, the DEA has arrested hundreds of doctors, and they're in prison. And these doctors write me from prison, and people will read the press release from the DOJ. They'll say, well, why would they lie? I'm not saying they're lying. I'm saying that they're only telling people a kernel of truth. And that's coming from a court reporter who sat in the grand jury room. And not every doctor was innocent, but
how do we turn the page on this? I know you had, and I don't know if it passed. I apologize. Claudias Bill, where doctors would not face legal recourse for what some considered overprescribing. They could prescribe as much as possible. Did that actually become law? And is that spreading?
Oh yeah, it's a law, and it's been taken into 5 other states, and now we're working on a federal law. And we need to have a DC lobbyist. We need to have a presence on Capitol Hill. I need to hire a lobbyist in all 50 states, because if not, then I have to be in all 50 states, which means I have to be on a plane and in a hotel and on the road. And it's hard to do with somebody with my illness. And my colleague also has Crohn's disease. So it's hard for us, but we need a federal law protecting both patients. We need a federal law where we can start to impose sanctions on doctors who are encouraging the suffering. The sickle cell community has been hit horribly. Uh, our veterans who served our country, they have been left for dead. And we need senators to listen. And there's a great representative out of California. Her name is Katie Porter.
Love Katie
And
Porter.
yeah, I think if anybody could take this on, it would be Katie Porter. You know, when I testify, I don't give these people any wiggle room. I tell people, I put them in the corner. I don't give you any room to wiggle out of your lies. And I'm like black licorice. You either love me or hate me.
Do you think that there is, though, a balance that needs to be had in the conversation to convince people? Because people, unfortunately, Claudia, were like how I was before Rev P and others came forward and said, you don't have the full story, Nikki. Stop watching Dopsick and Painkiller.
Yeah.
That's not the whole thing. But
Right.
people are like me, and they're like, I watch Dopsick and Painkiller, and that's the length of my understanding of it. I don't have chronic pain. I don't know anybody in chronic pain, so I don't have a personal relationship with this issue. So all my information is coming from Hollywood. Is there, and I'm not making light of this,
No.
but do you have any desire to fight Hollywood with Hollywood and
Yeah.
use Hollywood in that way of getting through to people, being like, that's all BS. What happened right there?
Oh, I started writing a screenplay. I
Good.
in the middle of the night, I wake up who I'm going to cast is that bloated pig, Chris Christie, right? Because there's so many that are responsible for the deaths of innocent people. And, you know, people ask me, well, is this a Trump issue or a Biden issue? It was actually created, the electronic health record system was created under the Obama administration, and Trump took a dumpster fire and made it 1,000,000% worse. But this was actually born out of the Obama administration, but it was a bipartisan effort. Both sides of the aisle have attacked the pain community. But the best advice I ever got, it was from my first lobbyist that I hired like 6 years ago. And he said, you just have to wait till they're affected. And now I get phone calls. I advocated for a former Navy SEAL. I've advocated for a judge whose son has ALS, and he was being forced to choose between his pain pill or his benzodiazepine. I'm contacted by judges, by lawyers, because I had to wait for people to suffer. And you only have a 50% chance of getting your pain treated. That's it, 50. And if you're already taking a controlled substance, it's down to 25%. I will say with confidence, over the next 2 to 3 years, every single person will be affected. If it's not you, it's going to be your loved one, because doctors are afraid. The younger doctors, they're crackpots. They've been indoctrinated. And those are the ones that I eat like biscuits, and I devour them by noon. I attack them because they're dumb, right? You know why? Because they've been raised on this. See, the young people, they can't make the connection like the older doctors with their patients. And, you know, they find me on TikTok too. The younger ones, I was like, you're okay. You need to gather your emotions, sit down, have a glass, because that's how you have to talk with them, because they're so abusive to people in the emergency room. I mean, I am astounded by what I've seen and by what I've heard from some of these younger doctors.
I can't imagine what it's like, and I knock on wood that, as you say, that, you know, we're all going to be touched by this eventually, but what it's like to have chronic pain day in and day out and not ever see it a light at the end of the tunnel, and know that this is your life forever and this is what you're dealing with forever. And you talked about the rough consequences of that. But what do you tell people as far as how they can deal with it and how they can get to a place where, you know, it becomes a part of life, but it's going to be okay for them?
Well, for some people, it won't be okay. And a lot of people will just choose, you know, suicide, or they'll choose patient assisted suicide. And the people that I advocate for, these are very, very sick, high acuity patients. They're not getting any better. But I don't really know how to answer it other than I organize a support group in Rhode Island. So it's a place where we can sit down, I feed people, and where they can lean on each other. So I think a support system could help. But for me, just fighting, I fight for these people. They don't have a voice. You got to work on laws. You've got to get involved. I've got a Facebook page for each state, because there's never going to be solace for these people, because now people, they were working. I advocated for a meteorologist out of Buffalo. He was taking 2 pain pills a day. He was cut off because his doctor's like, oh, I don't want to lose my license. And he's like, I've been on the air for, 26 years. I have to retire. So it's hard. Who wants to live when they're in pain?
Yeah.
Every day, round the clock. And what's sad is, like, after the DEA shut down one of our doctors in California, the patients contacted us, and there was no help. And Danny Elliott and his wife, they committed suicide after the DEA shut down their and these suicides they come in on a regular basis. And, I think myself and my colleague, now we're like numb to it because they're so frequent. And the DEA, that's why I think Katie Porter could be helpful. We have to hold people accountable. And the DEA is really the biggest culprit, along with that special interest group called PROP. See, everybody wanted to make money off of people who are suffering. And as a former court reporter, I thought I sat with the most hateful human beings in a courtroom. Oh, no, they had nothing on this. These are really bad people that have done this to these people, like elderly people suffering, and it's bad.
I mean, and it blows my mind that you keep saying that, because if they look at the numbers that you're mentioning about how the overdose numbers have been completely overblown and all those sorts of things, what do you think it is? Is it just to save face, to say, okay, we had it wrong? Is it as simple as you just can't admit that you were wrong, and you told all the people one story and it's completely the opposite? Is that it?
Well, everybody, I think in 10 years, they're going to, I already have lawmakers, when I testify, they'll say, oh, Claudia, we thought we were doing something good. I'm like, well, that's because you're stupid, because you didn't do your research. You're all stupid. You wanted to become an elected official. You bit off more than you could chew. You don't do your research, and they have all these bills thrown at them. But I think in 10 years, we're going to have hopefully, new lawmakers, and they're going to look back and say, this was the cruelest time in history. We were wrong. But I would still like to say, I want prison time. I want these people behind bars. And I think one day we'll have the evidence that we need to put them behind bars. But they're doubling down. They're actually doubling down, which is scary.
What can people do if somebody's listening and they know somebody that's in pain, they're in pain, their doctors aren't prescribing them pills? I mean, what do you tell people that call you up and be like, I need help? I'm in pain right now.
I know. So I receive probably 600 messages a week. A month, to help people. We have a Patreon subscription page. People should join that. Even if it's the $5 monthly membership, we need money. I can't travel without money. I can't get laws passed in your state without money. So, we either have to raise $1 million for me to pay a lobbyist, or we need to raise, bare minimum. And $1 million is not a lot of money. That's what I need just to have a presence. And thank God for TikTok.
Right.
If we didn't have TikTok, forget it. We still wouldn't have a voice. Join your Facebook page, go to our website, take advantage of our free resources, the doctor-patient forum. You can have a coaching call with myself or my colleague. We chose not to become consultants because the people we represent, they live on $900 a month. They have no money. And that's why the government was so successful in targeting us, because we are the poorest community. The Patreon page, the doctor-patient forum, is a great way to support us. Donate at our website. We're a 501c3. It's a tax deduction. But most importantly, inform yourself on the truth, because a lot of times people just don't know how to advocate for themselves. You must know the facts. And that's why I can speak so clearly and concisely on this issue. I know the facts. I know the studies. These folks need to learn the same way that we learned.
Is there anything that somebody could say to their doctor that would help them get the pain medication that they need?
Yeah. So depending on what state you live in, so Rhode Island has a law now, right? And I tell doctors, I worked my ass off for you for 5 years. Write the script and be done with it. And Colorado has a law. I believe Arizona has a law. Go on our website, see what states have laws, and then you can at least print out that law and take it to the doctor. But doctors call me and say, "I want a federal law, Claudia. I want a law saying I'm not going to prison,"
Right.
and that's what they want. So that's what we're working on, is getting that federal law protecting people. You can also print out various things off of our website, but I will tell your listeners, if you're looking for a new doctor, don't go to interventional pain doctors, because they're not going to help you. They're going to torture you. And in exchange, they're going to, if they're going to prescribe you 2 or 3 pain pills a day, you're going to have to agree to these procedures that have been banned in other countries. Those doctors are going to leave you worse off. So I say just boycott the drill mill. And I say that for a reason, because they're harming people, right? Now, you may have a good chance of finding a concierge doctor. So all you have to do is Google concierge provider near me. Those are cash doctors, right? They don't really work with insurance companies a whole lot. They're great providers. They're going to be more likely to treat your pain. Now, if you're living with something like CRPS, the suicide disease, or you're in kidney failure, or you have Parkinson's or ALS, I want you to contact a palliative care doctor near you. Those doctors are more willing to treat people with these palliative, diagnoses. And lastly, try your primary care doctor, and then also call your insurance company and say, "Please help me. I need a list of providers." But we need these insurance companies to back off, right? They're not covering opioids anymore, and now we've got this massive opioid shortage, and it's all because of this narrative.
Yeah.
So, there's many things that you can do. Unfortunately, most of them you probably won't be successful, but just know we are working every day, 24/7, to get you folks help. We're doing everything that we can.
Yeah. Claudia A. Merandi, thedoctorpatientforum.com, thedoctorpatientforum.com. I put it in the comments. It's in the show notes. Donate to her Patreon. Keep up this work, because it has been so eye-opening to me. I've watched you on TikTok as well, having you on this show. It really goes to show that you think you're getting the whole story, and you're just not. You're just really not.
Thank you, ladies. I appreciate the opportunity to come on.
Anytime. The door is always open. Claudia A. Merandi, thank you so much for coming on the Nikki Maduro Show.
Thank
Bye-bye.
you.